Hi, this is Robin Riddle with Brain Support Network. Thanks so much to Kim and MSA NJ for the opportunity to talk today about MSA brain donation. I'm delighted to be with you, but sorry it has to be virtually this year. I think I know many of the MSA NJ support group members from attending MSA Coalition conferences in the past. And I look forward to the day when we can get together again in real life. So that will be we'll all have to have a party and enjoy that time together whenever that can happen. So I'm delighted to talk to you today about MSA brain donation, how it helps families, how it helps researchers, and how it can be arranged. First off, I'd like to talk about some terminology. And first is brain autopsy versus brain donation. In a brain autopsy, which is possible 24, 48, 72, quite a few hours after a loved one's passing, the brain is analyzed post-mortem. Reports that are sent to families are very rarely prepared by a neuropathologist. Usually they're just prepared by a pathologist. And in the case of a brain autopsy, the brain is destroyed after it's analyzed. However, there's an opportunity for brain donation, which is what Brain Support Network is all about. This is possible up until 24 hours of a loved one's passing. The brain, again, is analyzed post-mortem, just like an autopsy, and the reports are always prepared by a neuropathologist. And in fact, the brain is saved in perpetuity for research, which is a wonderful thing. There are two key reasons for brain donation. The first is confirmation of a diagnosis, and this confirmation is only possible through post-mortem examination of brain tissue. Unfortunately, right now, there are no biomarkers, so there's no way to say when someone is alive for sure whether they have MSA or some other neurological disease. Having a diagnosis can provide closure and peace of mind to families. It can let families know what caused the symptoms that they had been dealing with. This may be helpful to children, grandchildren, and siblings. And there is, in fact, an incorrect diagnosis in 40% of all MSA cases, which is quite a high number. The second reason for brain donation is that it enables research into the causes, treatments, and cure for MSA. The diagnostic criteria for MSA are based on confirmed cases of MSA. And so the criteria are only as good as the support we have in the community for brain donation. Brain tissue is also required for genetic analysis, imaging studies, and validation of future biomarkers. There's an example here of a brain bank study that was published in 2015, and it's a very important study. It's called, the long title is When Dementia with Lewy Bodies, Parkinson's Disease, and Progressive Supranuclear Palsy Masquerade as Multiple System Atrophy. This was a Mayo Jacksonville published study, and in fact, Brain Support Network provided 25% of the 135 brains used in this study. And as I mentioned, the diagnosis of someone alive with MSA is wrong 40% of the time. And the two most common misdiagnoses are dementia with Lewy bodies, also called Lewy body dementia, and Parkinson's disease. And the third would be progressive supranuclear palsy. MSA research is made possible through brain donation. One question that we've had in the MSA community for quite a few years, at least as long as I've been in the community, is whether cognitive impairment is part of MSA and what that might look like. Also, is dementia part of MSA? What if dementia happens early in the disease course? Would we still call that MSA, or is that likely a different disease, such as Lewy body dementia? Are hallucinations and delusions part of MSA? We can also know through brain donation what the expected disease course and prognosis is of someone with MSA. And having a correct diagnosis is very important so that we enroll the right people in research studies. You can see from that Mayo Clinic study published in 2015 that 40% of the people we think have MSA, in fact, do not have MSA. So what happens if that incorrectly diagnosed 40% are part of research studies? Then we're not getting good research results on MSA. I'd like to point out that the new MSA diagnostic criteria should be published next month, April 2021, and it incorporates a lot of what we've learned through brain donation in the last several years. Brain Support Network recommends the Mayo Clinic. Oh, I'm sorry. Brain Support Network recommends the Mayo Clinic for brain donation. It's one of the top brain banks in the United States, and they actively publish on MSA using donated brain tissue, as we saw in that 2015 publication. Reports are delivered to families within 100 days, and Brain Support Network is available to explain these reports to families. We've read many hundreds of these reports and have a good understanding of the technical terminology used in these reports and are certainly delighted to help families. It's important that families order all of the neurological records and provide a written timeline of symptoms to the Mayo Clinic. There are some challenges with brain donation. First off, the brain recovery must occur within 24 hours. And in working with the Mayo Clinic, families generally bear the cost of the brain recovery, which is typically $600 to $1,000. Note that Cure PSP offers grants to families up to $750, so it's possible that the full cost of brain donation can be defrayed from this reimbursement grant. And advance arrangements with many different organizations are required to be successful with a brain donation. And that's where Brain Support Network comes in. We coordinate with the funeral home, cremation organization, or body donation program if your family member or you also plan to donate your body. We coordinate with the pathology service, we coordinate with hospice, and we coordinate with the care facility if there is one. Donating a brain requires the consent of a healthcare agent or legal next of kin. The family, as I said, must order all of the neurological records. This can certainly be done in advance. And the pathology service must be available daily because, of course, we have no idea when death might occur. And so it's important to find a service that is available 7 days a week, not just Monday through Friday. And it's important to know who does what, when, for how much, and why they're doing it. Many parties have to cooperate: the funeral home, the hospice agency, and the care facility if there is one. Brain Support Network coordinates all of these participants and prepares comprehensive instructions for each party. I'd like to talk a little bit about funeral home or cremation organizations because not all are cooperative. We've found in our brain donation work that only about half of the funeral homes in the United States are cooperative. And when I say funeral home, I also mean a cremation organization. It's the same situation. They must be cooperative 7 days a week, which means they must allow access 7 days a week. And it's ideal if they charge no fee to the family for accommodating the brain recovery. We would consider in our years of work on this that a reasonable fee might be $200, $250, particularly if the funeral home or cremation organization has to open up after hours for the brain recovery. I've listed a couple of URLs here, a couple of web pages on our website where we list the cooperative funeral homes in New Jersey North, New Jersey South, and the Philadelphia area. Certainly there are more cooperative funeral homes out there than the ones we know about. These are just the ones that we've worked with previously and have found to be cooperative according to the criteria on this slide. And you can see exactly on this slide, or I'm sorry, exactly on these three web pages, how much these funeral homes charge for accommodating the brain recovery, if anything. Brain Support Network requests a pay it forward charitable contribution from every family we help. For every $500 donated, we can help another family with comprehensive brain donation arrangements. Certainly, memorial contributions in lieu of flowers are welcome. So we suggest that you start brain donation arrangements when the intended donor is receiving hospice or palliative care, has been hospitalized, or is actively dying or transitioning. For MSA, we encourage anyone to contact us now in the process because many people with diagnosed with MSA pass away even before entering hospice. And this, of course, makes brain donation much more difficult to achieve because the county coroner has to be involved. And so we may not hit that 24-hour deadline, but having arrangements in advance gives us a better chance, a better likelihood of achieving the brain donation. We encourage you to check out Brain Support Network's website. We have a whole section on brain donation with a lot of information. We have some terrific case studies. Katie Kim, who was an MSA NJ support group member for many years until she passed away. There's a case study about her. MSA was in fact confirmed. Case study of Bob Thomas, Joel Tevet. They both had MSA, as well as John Inez Pastor. These four people were diagnosed with MSA during life, and in fact, the MSA diagnosis was confirmed upon their passing. In contrast is a case study of Jack Campbell, who was diagnosed with MSA during life, but in fact, it was found he had Parkinson's disease. This, I'm sorry to say, was a missed opportunity because if we had known he had typical Parkinson's disease, the family could have tried Sinemet, a higher dose of Sinemet, and perhaps Jack Campbell would have gotten some relief with Parkinson's related medications. There's another case study of Joseph Nicolazzi. He was diagnosed with MSA during life, but in fact had Lewy body dementia. He unfortunately was given medications that people with Lewy body dementia should not be given, and they made his Parkinsonism symptoms far worse. So if he had been accurately diagnosed with Lewy body dementia during life, again, different medications could have been available to him or have not been prescribed for him given that diagnosis. We have on our website an extensive list of frequently asked questions, and there's a process document you can see on the right of the slide indicating what the donor's family needs to do and what Brain Support Network does at each step. We encourage you to go to our website, brainsupportnetwork.org or brainsupportnetwork.com, either one works, and fill out our soon or immediate need form. This form will indicate that you or your family member has MSA, and it tells us what funeral home you plan to use. We'll call that funeral home and find out if they're cooperative or not, and we'll get back to you with further details. Brain Support Network was founded in 2004. We started actually as a local support group for PSP, MSA, CBD, and Lewy body dementia. We became registered as a 501c3 nonprofit in 2012. We have 7 employees. Everyone's working from home. Even prior to the pandemic, we were all working from home. We don't have an office. And we have dozens of volunteers. We're based in Menlo Park, California, which is just south of San Francisco. We've organized almost 1,000 brain donations of all neurological diagnoses, many of those with MSA, and many people who are healthy controls, which is a wonderful thing to donate a brain. So we've helped almost 1,000 families donate a loved one's brain. We'd be very happy to help your family too. You can contact us at brainsupportnetwork.org. You can see my email address on the slide. It's robin.riddle@brainsupportnetwork.org, or our main phone, which is also my cell phone. It accepts text messages, is 650-814-0848. We look forward to helping you and your family members. Thank you so much. I look forward to your questions.